One of the most common metabolic disorders is phenylketonuria, known as PKU, and also referred as Fowling's disease. In 1934, a mother with two severely mentally ill children sought the help of Dr. Abjorn Fowling of Norway. Dr. Fowling, a biochemist, discovered that the children's urine samples contained high levels of phenylpyruvic acid. Individuals with PKU have a defective phenylalanine hydroxylase enzyme and cannot break down amino acid phenylalanine, which can increase to toxic levels in the body. PAH enzyme works with cofactor tetrahydrobiopterin, or BH4. Some individuals have a functioning enzyme, but a deficiency in BH4 cofactor, leading to high levels of phenylalanine. PKU is inherited in an autosomal recessive manner. This means that individuals with PKU must carry two defective alleles of the gene. In the United States, PKU occurs in 1 in 15,000 newborns. Some ethnic groups have higher rates. Turks, for example, have a 1 in 2,600, and Irish have a 1 in 4,500. As where the Japanese have a lower rate of 1 in 143,000. In 1992, Dr. Savio Wu discovers the PAH gene. The gene is located on chromosome 12q22 through q24.2, which means it's located on the long arm of chromosome 12 at position 22 through 24.2. PAH gene provides instructions for the making of phenylalanine hydroxylase. PAH is produced in the liver where the metabolic chemical reaction of phenylalanine to tyrosine occurs. The enzyme is activated by binding oxygen and BH4, converting phenylalanine to tyrosine. Tyrosine is then transferred to the bloodstream, to cells in the brain, and other organs. Amino acid tyrosine is also used for the making of many other hormones that transmit signals in the brain. More than 500 mutations in the PAH gene have been identified. Most of these are missense mutations, changing single amino acids in phenylalanine hydroxylase. For example, the most common mutation replaces the amino acid arginine with amino acid tryptophan at position 408. Other PAH mutations delete small amounts of DNA from the gene. Untreated individuals develop severe mental retardation and other health problems such as seizures, eczema, and a musty odor in sweat and urine. The disease also causes delayed development, behavioral problems, and psychiatric disorders. Due to the absence of tyrosine, PKU patients also have lighter skin and hair. Today, newborns in the United States are screened for signs of PKU. Treated individuals follow a free alanine diet and medication. Kuvan medicine is the first only pharmaceutical version of PH4, stimulating PAH enzyme activity. Kuvan helps patients with a deficiency in the BH4 cofactor. Not all patients respond to Kuvan positively. Enzyme substitution therapy with phenylalanine ammonia lyase is currently under clinical investigations as a possible alternative treatment for PKU. Phenylalanine ammonia lyase converts phenylalanine to tranexamic acid, which in humans is rapidly converted to hyperuric acid, which is then excreted in the urine. Mice with a mutated PAH have been treated with phenylalanine ammonia lyase, and results have shown correction of blood phenylalanine levels. Scientists have also been working with gene therapy, which replaces a non-functioning gene with a normal copy. In gene therapy, the gene of interest is isolated and cloned through a vector, either a virus, plasmid, or liposome. The vector is then inserted into the patient. Liver-directed gene therapy has been tested in mice, and results have proven for up to 1 year correction of hyperphenylalanemia. The hard work of doctors, scientists, have made individuals with PKU live more promising lives.